Assalamu alaikum students. Today I have very important and very interesting topic for you. It's regarding the healing process after the fracture. So anywhere in the body, if there is any injury, well, let it be skin, let it be soft tissue, let it be cardiac tissue, let it be the liver or anything, it need to heal. So there is a process of healing. So the same way, when there is injury to the bone in the form of the fracture, it tries to regain its original shape, original strength. This process is called as this is healing process of bone. So will be before starting the proper topic, we need to know a little basic about the bone formation. So if you see, if you consider embryo, there are two types of bone formation. One is called as endochondrial ossification, other is called as intramembranous ossification. What is endochondrial ossification? What happens is in the fetus, we have mesenchymal tissue. This mesenchymal tissue get converted into cartilaginous tissue. And during the course of time, this cartilaginous tissue get converted into the bony tissue. This type of calcification is called as endochondrial ossification. Whereas the other form is the mesenchymal tissue, it condensed and forms the bone directly without interface of cartilaginous tissue. This type of ossification is called as membranous ossification. So if you see in endochondrial ossification, what is happening? Mesenchymal tissue, then it is getting converted into cartilaginous tissue with invasion of conversion to chondrocytes. Then over the period of time, this cartilaginous tissue get converted into bony tissue by formation of osteoblasts. So there is cartilage. Cartilage means chondrocytes. Chondrocytes means chondral ossification. Then the other way is intramembranous ossification. What is happening in intramembranous ossification? The mesenchymal tissue is directly converted into bony tissue by formation of osteoblast. There is no cartilaginous stage in intramembranous ossification. Then depending on the arrangement of the bone trabeculae, we have two types of bone. One is called as woven bone, other is called as lamellar bone. तो woven bone कैसे रहेगी? अगर आप देखें तो कॉटन, जब आप पेड़ पे से कॉटन निकालेंगे तो it will be something like unorganized fluffy material. So this is how the woven bone resembles. This is a stage before the final bone formation. यही आपका कॉटन चीज को आप अच्छे से थ्रेड्स अलग करके if you arrange it, it forms the lamellae, very organized form. This organized form is called as lamellar bone. So I think I am clear with you what is woven bone, what is lamellar bone. Then the other way to classify the bone is depending on the strength of the bone and arrangement, tightness of the trabeculae or tightness of the bony structures or spaces inside the bone. So we have two types. One is called as compact bone, other is called as spongy bone. So compact bone, by its name, it's dense and solid. So dense and solid means it gives strength and also protection. So where we find compact bone? We find compact bone in the outer border of the long bones. That is, cortices of all long bones is compact bone. The counterpart of the compact bone is spongy bone. Spongy bone is porous, and it's a porous structures. If you see here, spongy porous, and it contribute for the shock absorption. It's seen in flat bones. So it resembles that of sponge. Sponge. So we have spongy bone in the metaphyseal region. We have compact bone in the cortex region. So you need to be very clear about this. What is endochondrial ossification? What is intramembranous ossification? So intramembranous ossification, there is no intermediate stage of chondrocytes or cartilage formation. What is woven bone? It is the early unorganized bone. Lamellar bone is late organized final shape of the bone. We call it as lamellar bone. Then depending on the strength and the presence of trabeculae inside, we classify as compact and spongy bone. Compact bone, it's solid and dense. Spongy bone, it's little porous and have less strength. Now we'll move to the next slide. It's a proper fracture healing. What is fracture healing? How will you define a fracture healing? So it's a series of complex sequential set of event, one stage followed by another stage, after sometimes the third stage, and finally it enter to the final. So it's a complex and sequential events. Why these are happening? To restore the injured bone. What they want to restore? They want to gain the pre-fracture condition. So before the fracture, what was the strength of the bone? By the healing process try to attain the same strength. So what is the important thing in the fracture union? We need to have stem cells. So stem cells, where we find stem cells in the bone? So if you see the cut section of the bone, there is a periosteal lining. So periosteum have two layers. One is called as cambium layer, other is called as fibrous layer. So this is fibrous layer. This is the arrangement of the fibers. Over that we have cambium layer. Cambium layer has stem cells in this, osteocyte in this. So these, whenever there is a need after the fracture, they convert into the required other cells. So we have stem cells which is responsible for fracture union. So these are present in the periosteum in the cambium layer. This point is very important. Sometimes you'll be asked in your PG entrance also where you find the cells in the periosteum. It is present in cambium layer, not in the fibrous layer. Then we have some stem cells also present in the endosteum also. So if you see the cut section of the bone, it resembles that of a trunk of the tree. So it resembles trunk of the tree. How it resembles trunk of the tree? The outer part is the bark, which is like fibrous layer, very acellular, just gives support. Then the inside layer is the cambium layer, where the new layers of the new tissues will form. Same way we have fibrous layer followed by the cambium layer in bones. I think I am clear in explaining to you about the cambium layer and the stem cells and the fibrous layer of the periosteum. So now we'll move on to modes of fracture healing. Like we have different types of healing in the skin wound, like primary, secondary, and tertiary. We have two types of bone healing process. One is called as first one is primary bone healing, and the second is secondary bone healing. So primary bone healing. What is primary bone healing? It is similar to that of soft tissue or skin laceration healing after suturing or approximating the cut ends. Here, if you see, there is a laceration and you have approximated to the maximum extent with skin to skin contact. So here the scarring is minimal, and granulation tissue inflammation, everything is very minimal. Same way, if you see here, there is a fracture. Here you have fixed the fracture with very rigid plate. So there is no movement. Fracture is in maximum approximation to each other. So here the amount of inflammation is very less. Due to less amount of inflammation, there is no callus formation. So this is called as primary bone healing. So what we need for the primary healing? Approximation of the ends. There should be a maximum approximation of the end. There should be a compression at the ends, and there should be some rigid thing to fix it or hold it so that there is no any micro movement possible at the cut side. So what is primary bone healing? It resembles that of intramembranous ossification. So in the first slide, I have explained you that what is intramembranous ossification. Intramembranous ossification is the type of ossification where we are not having cartilage in a space. The stem cells are directly getting converted into bony tissues. So primary bone healing is by intramembranous ossification, where we find when we have a very rigid fixation in the form of locking plates we apply after the fractures. So there is no involvement of callus formation because there is very minimal inflammation here. As you see in primary bone healing, the fracture ends are very much approximated, so there is no space for the callus to form. So here what is happening is osteoblasts are originating from the endothelial and perivascular tissue. Then we are moved to the secondary bone healing. This is very important because most of the time bone heals by the same process, that is secondary healing. and it is very preferable type of healing, because the final tissue or final bones formed after the secondary bone healings have same strength that of the bone it has before the fracture. So it involves response in the periosteum, response in the external soft tissue also. We won't have this external soft tissue response when the fracture is healing by primary intention, but we have this when fracture is healing by secondary intention. So it resembles that of endochondral healing, endochondral ossification. To recall, what is endochondral ossification? The stem cells getting converted into stem cells, then getting converted into cartilaginous cells, then finally getting that converted into bone. So we have same type of thing when we have secondary bone healing. Okay, it forms. We have the same when patient is the fracture is healing by secondary bone healing. So if you can compare this with the secondary healing method of process of skin. So there is a very infected thing, infected tissue here. We have excited. We didn't give the sutures and we left the wound open for secondary intention. So over the period of times, the new tissue is formed and it is healing by the scar formation. So just to recall here, we have few tissues which heals completely without leaving any scars after the injury. It goes B, B, B. Bone marrow, blood and bone. आप क्या करें, पेशेंट का ब्लड लें डोनेशन के लिए. आप 100 ml लियो, 200 ml लियो, 500 ml लियो. Within 1 week or 2 weeks, the whole amount of blood is replaced without any residual deficit. The same way, if you take bone marrow for the transplantation from the donor, it recovers completely. Same way, when the bone has the fracture, over the given period of time, after the remodeling, there is no any scar left over over the bone. So it resembles that of the natural bone. So where we find secondary bone healing? Primary bone healing किधर आ रहा था अपने को? When we are fixing the fracture very rigidly with no any movement possible. Here we are not fixing very rigid, but we are just giving relative stability. So where we have this, when we are planning to manage the fracture with braces, like application of plasters or something like that, or we are using external fixator, or we are using some bridging plate, which the screws are away from the fracture and not holding it very tightly. Same way in intramedullary nail. So this is the type of primary bone healing and the secondary bone healing. So what are the steps in fracture after the fracture? If the fracture breaks, there will be bleeding at the fracture site. So this bleeding, when consolidated, it forms hematoma. Hematoma induces inflammation. So once inflammation starts, there will be accumulation of different types of cells. They form the primary callus. So there is formation of primary callus. What is primary callus? It contains granulation tissue. It contains fibroblasts arising from the stem cells. It has some new blood vessels forming around the granulation tissue. So then primary callus, over the period of time, due to formation of cartilaginous cells, that is chondrocytes, forms the cartilage. This cartilage then start mineralization and bone formation and forms the unorganized bone, which is called as woven bone. आपको याद होगा, woven bone is something like a cotton balls. So before, it's a raw material we get in the form of cotton from the plants, which is very ill organized and fluffy. So over the period of time, due to the remodeling process, finally it forms a lamellar bone or the original compact bone. This is the series of changes which are happening during the process of fracture union in secondary bone. So this is called as healing process. So इसको और अच्छे तरीके से जैसा हमको प्रेजेंट करने के लिए, याद रखने के लिए, क्लासिफाई करने के लिए, we distribute this whole process of fracture union into 3 stages: reactive phase, reparative phase, and last is remodeling phase. ठीक है? First is reactive, second is reparative, third is remodeling. अगर आपको एग्जाम्पल लेना है तो एक टूटी दीवार का ले लीजिए. क्या है, कहीं हवा तेज हुई, तूफान आया तो क्या होता? दीवार डैमेज होके पूरी गिर गई है दीवार. So this is somewhat like फ्रैक्चर। ओके, इसके बाद क्या हो रहा है, हम थोड़ी देर सोचेंगे, सोच के क्या करेंगे, इसकी सफाई करेंगे, पूरा जो जो भी नीचे गिर गया है, मलबा गिर गया, उसको साफ करेंगे। सो दिस रिजेंबल्स द रिएक्शन। सो एक बार दीवार गिरने के बाद जो रिएक्शन रहेगा, दैट इज क्लीनिंग। सो इट रिजेंबल्स रिएक्टिव फेज। एक बार पूरी सफाई करने के बाद वी assemble the thing or we get the things required for the building of new wall. So it resembles that of our new नई दीवार जब बनाएंगे तो it resembles reparative phase, reparative phase. Lastly, एक बार आप अच्छे से दीवार बनाए तो we try to polish it so that it attain the same how it was before there was accident. So this is called as remodeling. अगर आप ये इतना याद रख लिए तो you can write essay answers अगर एग्जाम में आया तो आपको, ठीक है। सो द सेम वे व्हाट इज हैपनिंग, देयर इज अ फ्रैक्चर, देन देयर इज reactive phase, then this is followed by reparative phase, all the process of reparative phase, then finally it goes into remodeling phase, remodeling stage. तो समझ में आया है आप लोगों को, रिएक्टिव, रिपेरेटिव, रिमॉडलिंग। So reactive phase, it's last up to days to 3 weeks. ये आपका रिपेरेटिव फेज 3 weeks में स्टार्ट हो जाएगा, 3 weeks to 3 months. देन रिमॉडलिंग फेज क्या है बोलते हो, 3 months से कंटिन्यू अप टू 18 months. ये हार्ड एंड फास्ट रूल नहीं है, इट हैज ड्यूरेशन वेरीज विद द एज ऑफ द पेशेंट, then build of the patient and many factors, and also which bone is fractured. ओके, रिएक्टिव फेज में हम 3 में डिवाइड करेंगे इसको, फ्रैक्चर फॉलोड बाय इन्फ्लेमेटरी रिस्पांस, देन देयर इज अ स्टेज ऑफ हेमाटोमा फॉर्मेशन, हेमाटोमा के बाद ग्रैनुलेशन टिश्यू बन जाएगा। Then reparative phase में we have two phases. One is cartilaginous bone formation or cartilaginous callus followed by lamellar bone deposition. This cartilaginous callus invaded by osteoblast and form the lamellar bone finally. Then remodeling phase, here the original bone try to attain it the original shape by the process of remodeling. एक एक फेज को हम अलग से थोड़ा सा डिटेल में पढ़ेंगे। So in the reactive phase, रिएक्टिव फेज 1 हफ्ता से 3 हफ्ते तक लास्ट होगी। इसमें क्या है बताओ, एक बार फ्रैक्चर होने के बाद क्या होगा, ब्लीडिंग होगी, थोड़ी देर ब्लीडिंग होकर ब्लीडिंग हैज टू स्टॉप बिकॉज इन एवरीवन आफ्टर ब्लीडिंग टाइम एंड क्लॉटिंग टाइम एक बार हेमाटोमा वो सील हो जाएंगे ब्लड वेसल्स। सो आफ्टर ब्लीडिंग व्हाट हैपेंस, ब्लड वेसल्स गो इनटू कंस्ट्रिक्शन एंड स्टॉप एनी फर्दर ब्लीडिंग। उसके बाद क्या होगा, वो जो भी ब्लीडिंग हुई इट विल ऑर्गेनाइज्ड एंड फॉर्म द हेमाटोमा। सो हेमाटोमा इट लास्ट फ्रॉम फ्यू आवर्स आफ्टर द फ्रैक्चर। इसके बाद जो जो भी ब्लड हेमाटोमा हुआ वहां पे क्या होंगे, थोड़े ब्लड सेल्स आएंगे। then this and this hematoma act as a what we call it act as a basic structure where all hemopoietic cells are there. These hemopoietic cells secretes lot of neurotransmitters, growth factors and all. Then उसके एक बार हेमाटोमा होने पास क्या होगा, अब वहां पे माइक्रोफेज आएंगे, जैसे हमने मलबा साफ करने के लिए इनको उनको बुलाएंगे ना, सेम वे जैसे। तो व्हाट हैपेंस इज माइक्रोफेजेस, न्यूट्रोफिल्स एंड प्लेटलेट्स एवरीथिंग कम्स at the point of hematoma and they start resorbing the hematoma along with the fracture ends of the fracture to freshen the fracture end. Then followed by fibroblast. उसमें से क्या होगा, stem cells will change into fibroblast which act as a scaffold for the future formation of bone. यहाँ पे we got macrophages, neutrophils, platelets etc. तो इनका काम क्या है, एक तो जो भी हेमाटोमा हुआ उसको क्लियर करना है, उसके बाद नई टिश्यूज बनाना है, साथ में और क्या करेंगे वो, they start secreting the various proliferating factors, platelet like growth factor, tumor necrosis factor, and the interleukins and all they start secreting. तो ये क्या करेंगे, local factors they increases the migration of cells, they increases the production of the further tissues. then the whole hematoma is getting changed with the granulation tissue. Granulation tissue में आपको क्या क्या है? Granulation tissue में stem cells है, granulation tissue में macrophages है, granulation tissue में neutrophils है. इन लोगों का काम क्या है? They have to secrete all the various local factors which increases the formation of new tissue. Reactive phase के बाद में कहाँ जाएंगे हम? Reparative phase में. Then स्टार्ट द रिपेरेटिव फेज. रिपेरेटिव फेज क्या है? इसमें पहले कार्टिलेजिनस टिश्यू बनेगा, फिर उसके बाद में लेमिनार टिश्यू बनेगा. पहले कार्टिलेजिनस टिश्यू, देन लेमिनार टिश्यू. सो इट इज स्टार्ट फ्रॉम 1 वीक टू 4 वीक्स. इसमें क्या हो रहा है? पेरियोस्टियल सेल्स आ जा रहे हैं. पेरियोस्टियल सेल्स क्या होते हैं? उसमें स्टेम सेल्स रहते हैं. हमने पीछे पढ़कर आया है कि जैसे वी हैव पेरियोस्टियम में 2 लेयर्स. वन इज cambium layer, other is fibrous layer. So cambium layer के जो cells रहेंगे that change into chondroblast and osteoblast. So पहले chondroblast में change होंगे, फिर osteoblast में change होंगे. इनका काम क्या है? न्यू chondroblastic and osteoblastic tissue फॉर्म करना. तो न्यू chondroblastic और osteoblastic tissue जो फॉर्म होगी वो ऑर्गेनाइज हुई, तो उसका प्रॉपर नेम क्या है? कैलस. कैलस क्या रहेगा? कैलस कंटेन ग्रैनुलेशन टिश्यू, पार्ट ऑफ hematoma, resorbing hematoma, granulation tissue and chondroblastic and osteoblastic tissue along with the fibrous tissue. इस एक बार जैसे आपको osteoblastic tissue का action start हुआ था, it formed very unorganized bone which we call it as woven bone. So here this is cartilaginous callus formation ends when woven bone starts forming. एक बार woven bone form हुआ वैसे over the period of time, that is 4 weeks to 8 weeks, it forms lamellar bone. So the woven bone जो भी है, it will get arranged properly and form the lamellar bone. And mineralization also starts in this stage. So calcium वगैरह deposit होके they start regaining the strength. So the new lamellar bone is formed in the form of trabecular bone. तो पहले जो लेमिनार बोन फॉर्म होगी वो उतनी स्ट्रेंथ वाइज उतनी स्ट्रांग नहीं रहेंगी, क्योंकि देयर विल बी लॉस और लॉट ऑफ fibrous tissue and the granulation tissue. So it will be like a spongy bone or trabecular bone. Then over the period of time it will change into compact bone. तो पहले जो आपको lamellar bone form होगा, it is more like trabecular bone. So ये आपका एक डायग्राम है कैलस का. अगर आप देखें तो यहाँ पे फ्रैक्चर हुआ है. सो दीज आर फ्रैक्चर है. सो दिस इज द कैलस इनसाइड द बोन. इन द इनसाइड द बोन इट्स कॉल्ड इंडोकैलस. और ये कैलस जो है जो बाहर फॉर्म हुआ है, इट इज एक्सटर्नल कैलस. इंटरनल एंड एक्सटर्नल कैलस. इंटरनल कैलस में ये दो है, एक्सटर्नल कैलस में ये एक, ये दो. ओके, दिस इज मेडुलरी कैलस. This is seal कर रहा है in medullary canal, so it's called as sealing callus. Sealing callus and internal callus. ये क्या है? मतलब periosteum में आपको callus form हुआ, it's called as periosteal callus and it's also called as anchoring callus. ये क्या है? मतलब it's in the proper hematoma, so it's called as bridging callus. Bridging callus, periosteal callus, sealing callus, internal callus. अगर यहाँ पे आप प्रॉपरली देखें तो in this diagram you can find it. Okay, this is internal or in the fragment, so internal interfragmentary callus. This is sealing the medullary canal, so it's called as sealing callus. This is bridging the two fracture ends, so it's called bridging callus. This is bridging callus. ये क्या है बोलते हो? आपको जो बोन का पेरियोस्टियल टिश्यू रहता उसके अंदर में कैलस फॉर्म होगा. So this is periosteal callus, otherwise called as anchoring callus. Am I clear? तो आप पीछे पढ़े थे कि प्राइमरी बोन यूनियन जिसमें we won't have callus formation. This external callus is deficient. So we won't have periosteal callus and we won't have bridging callus. So bridging callus or periosteal callus both are missing in periosteal callus, both are missing in primary type. Whereas we find periosteal callus and anchoring callus and breaching callus in secondary bone healing. Then एक बार आपको जो है सो as we know, first there is woven bone followed by lamellar bone. First the type of lamellar bone form is spongy bone. Spongy bone में हम पढ़े हैं it is not for the strength, so it need to get converted to compact bone. Compact bone is the final bone we need to get to have the proper strength of the bone. So कब आएगी अपने को compact bone or strength? When the fracture union enters into the remodeling phase. So it happens after 2 to 3 months and can extend up to 18 months. 18 महीने तक भी we have remodeling phase. So remodeling phase में क्या हो रहा है? Trabecular bone is slowly replaced to compact bone. Trabecular bone क्या है? Otherwise spongy bone, it's not so rigid or not very not give proper strength. So compact bone is rigid and with protection and strength. So trabecular bone is कैसे replace हो रहा है compact bone को? Trabecular bone it will get resorbed by osteoclast. Here the osteoclast start playing the role. अब तक क्या था? Chondroblast and osteoblast. Osteoclast start playing their role in the healing process of fracture in the stage of remodeling. So osteoclast क्या करेंगे? They absorb the trabecular bone. करके इसके बाद wherever they absorb, they produces the pit. This is called as Hausmann's lacunae. Then एक बार pit बन गया तो it need to be filled up. तो filled कैसा होगा? The osteoblast migrate here, then start forming the compact bone. जहां जहां pit form हुआ, there will be new osteoblast coming there and forming the compact bone. So just to recall, fracture हुआ, hematoma बना, inflammatory cells, WBCs वगैरह आए, then the stem cells पहले fibrous tissue बनाए, cartilaginous tissue बनाए, then the cartilaginous tissue start forming the bone. Bone में जो पहले form हुआ, that is fluffy woven bone. Over the period of time, that forms a compact trabecular bone. Then trabecular bone over the period of time resorb होके replaced by compact bone. एक बार compact bone हो गया बोलते तो fracture union हो गया पूरा. Fracture union हो गया बोलते the fracture has attained its end mark. Fracture union attained and healed completely. So over the that's how the fracture get remodeled or callus forms the normal bone. यहाँ पे अगर देखेंगे तो this is the X-ray where there is a fracture of the femur. So we have bridged it with the plate. It's just giving the relative stability. There is some movement at the fracture side. So what happens is here it forms the secondary callus. यहाँ पे देखें तो there is the formation of secondary. It's healed by secondary intention formation of external callus. हम अभी पढ़कर आए हैं external callus में क्या करेंगे आपको? Periosteal callus. Sorry, periosteal otherwise called as anchoring callus, and we have outside a breaching callus over the hematoma. ठीक है, over the period of time यहाँ क्या हुआ है? Ossification start होके we have formed the bone which is spongy bone, trabecular or spongy. This finally remodels and forms the compact bone. This bone has same strength that of the surrounding bone. Remodeling खत्म होने का और एक एक्सरे साइन क्या है? There is opening of the medullary canal. पहले क्या हो गया था? Medullary canals are sealed by sealing callus. तो ये sealing callus भी absorb होके remodel होके medullary canal will open up. Once the medullary canals, so what are the two X-ray findings of completion of remodeling? वन इज मेडुलरी कैनाल ओपन हो जाता है आपका, एंड सेकेंड थिंग इज द कॉर्टेक्स की डेंसिटी at the fracture site is same as the density of the surrounding normal bone. तो जब ये दोनों चीज मैच हो जाएंगे तो it's represented the fracture has completed its union process and remodeling is now end. So when we know the process of fracture healing, we need to know what the factors which affect union process. So we can classify it as internal factor, then systemic factor, and some iatrogenic or medical factors. So internal factors क्या है? Blood supply. This is very important क्योंकि बॉडी में कुछ ऐसे बोन है that the blood supply is not very vast. They have very limited blood supply, so they have high risk of developing non-union or delayed union. Then soft tissue attachment. Why soft tissue attachment is important? Because after the injury, sometimes what happens is there is an open fracture. So there is loss of periosteum, sometimes there is loss of surrounding muscle and all. So if that is lost, then the proper vascular supply of the bone is hampered and patient will have problem with the healing. So bony soft tissue attachment. Then stability. So stability अभी पढ़कर आए हैं हम, is very rigid fixation, primary union. Relative stability, secondary fracture union. Location of the injury. If injury happens in the bone which is very much covered by the muscles, the vascularity is more, so the healing process is fast. Then soft tissue loss or bone loss. कभी open fracture में क्या होता है, थोड़ी सी bone निकल के गिर जाएगी. So that is avascular. So that defect need to be repaired by the healing process. So it takes more time if there is loss of bone or soft tissue, and the fracture pattern also. So if it is transverse fracture, the healing will be little fast. If it is uh, like spiral fracture, the healing will be very fast. So fracture pattern, whereas segmental fracture or fracture with the butterfly fragment, it takes more time. Then comes to the systemic factors. Systemic factors, the first is age. Kids or pediatric population, they heals the healing happens very easily when compared to the early age. Nutritional status, main thing is protein. So protein deficiency or malnutrition, poor healing. Vitamin deficiency, very poor healing. Then smoking decreases the healing process. Then patient who has chronic kidney disease, diabetes, HIV infection, in all these patients the chances of healing slows down because the inflammatory changes are happening very slowly. Then the tissues callus forming is not very healthy. Head injury, this is one thing you need to remember, is when patient is having associated head injury after the fracture heals very fast. Fracture heals fast. So this is due to secretion of brain natriuretic peptide. So I don't think you need to remember it. You just remember that in the head injury, the fracture healing process is fast. Then medication. This medication you need to avoid after the fracture as much as possible. Bisphosphonate. Bisphosphonates का काम क्या है? They inhibit osteoclast. Osteoclast inhibit हुए तो what is happening? The formation of conversion as I told, bisphosphonate affect osteoclast. Osteoclast का function क्या पढ़कर आए हैं हम? Final formation is a compact bone. So compact bone, we get spongy bone. So osteoclasts are responsible for resorption of the spongy bone and formation of compact bone. This step will get affected. So when this affected, then there are strength on remodeling will get inhibited. So it affect on remodeling. So we are not supposed to give bisphosphonates after the fracture. NSAIDs. NSAIDs का main action क्या है? Inflammation को decrease करना है. So we need inflammation for the fracture. फ्रैक्चर अगर यूनाइट होना बोल तो आपको लोकल इन्फ्लेमेशन होना जरूरी है, वरना आपको जैसो पूरे मार्कर्स और जैसो नए सेल्स जो आएंगे वो स्टॉप हो जाएंगे. सो वी शुड नॉट गिव NSAIDs फॉर लॉन्ग टाइम. Once the pain relief, we need to stop giving NSAIDs. Then steroids. Steroids, again, they also reduce the inflammation, and they have decrease the formation of proper collagen. Quinolones. Quinolones क्या है? Quinolones are antibiotics, ciprofloxacin and all. What is this? This inhibit formation of RNA. So they inhibit the formation and proliferation of cells. That's the reason they need. I mean, we should not give quinolones after the fracture. So this is all about the fracture healing process, factors affecting the fracture healing, and types of fracture healing. So you need to remember this because this is one of the important topic you get in your theory exams. It's a essay bit for theory exam, and so a lot of questions you will get in practical also. So I request you to please subscribe to the channel and let me know the reviews. How is the presentation? If you want any changes, please comment in the inbox so that I can improve in the next class. And if you want any specific topic to be uh, taught to you, then you can message me personally. Thank you. Thank you for reading.